Next, let's discuss MDMA, otherwise known as ecstasy. MDMA, again, is used by a very small fraction of high school students these days. It's mildly addictive and has no medical use as of yet, although there is some research into looking for its possible treatment of PTSD. MDMA is a stimulant. It's chemically synthesized and not found in nature. It's taken in pill form, which means it enters the digestive system, so it usually takes effect in about 20 minutes, and it lasts 6 hours. The effects of MDMA on the body is that it increases serotonin, dopamine, and norepinephrine levels in the brain. Serotonin regulates mood, appetite, and sleep. And by increasing serotonin, this gives you a happiness feeling and full of energy. Dopamine is what makes this drug mildly addictive. Norepinephrine, otherwise known as adrenaline, increases energy, respiratory rate, cardiovascular system activity, and neural activity. MDMA also releases oxytocin and vasopressin. This leads to a feeling of love, trust, and a desire for sexual intercourse. This increase in energy and euphoria also leads to empathy toward others and a distorted sense of time. It increases body temperature, which can unfortunately lead to hyperthermia, which is different than hypothermia, and dehydration. The increased body temperature and dehydration has led some people to consume so much fluid while on MDMA that they end up killing themselves. There is a small risk of these negative side effects. Long-term effects of MDMA use have been discovered as well. It may impact memory, generate depression, because you're so used to having that feeling of happiness and being full of energy while on the drug, anxiety, and liver and tooth damage. And this is a result of your serotonin receptors becoming depleted over time. Overdose can occur and result from heart failure, stroke, or organ failure from the hyperthermia or the increased body temperature we talked about before. As I mentioned, MDMA is currently being investigated for psychotherapeutic research. It's tested for treatment of PTSD by asking patients to revisit traumatic events in a safe place while on MDMA. This leads them to remember painful memories while being on a drug that increases trust, euphoria, and energy, trying to replace these negative memories with positive ones. Many of the drugs that we've talked about thus far have not seen a major increase in use in the United States, with the exception of nicotine in vape pens and cannabis as it's becoming recreationally legal. But we have seen a dramatic rise in the last 10 or so years in one class of drugs across the United States, and that is prescription drug abuse. There are different categories of prescription drugs that people abuse these days in the United States. And those different categories are stimulants, opioids, and depressants. These drugs are easy to acquire online and from pharmacies. And because they are regulated as prescription drugs, many of them have potential for addiction. They kill over 100,000 people every year in the United States with accidental overdose. Opioids attach to opioid receptors in the brain and diminish the perception of pain, thereby increasing the feelings of pleasure. These drugs also cause drowsiness, constipation, and physical dependence. Overdose in these drugs is fairly easy and can result in death. Depressants, especially those of the central nervous system, slow down activity in the brain. These drugs increase the activity of GABA. GABA is a neurotransmitter that inhibits the activity of brain cells. People can feel drowsy or calm when they're on these types of depressants. which include things like Valium and Xanax. Eventually, too much GABA can cause confusion and slowed breathing, leading to death in cases of overdose. Our last prescription drug that's abused in the United States are stimulants. These include things like Adderall. These drugs are similar to key brain neurotransmitters, increasing levels of chemicals in the brain, eventually increasing blood pressure and heart rate and respiration. Overdose causes anxiety, tremors, an irregular heartbeat, and hyperthermia, or an increase in body temperature. Cocaine is a drug that used to be used a lot more frequently in the United States and is being used less so these days. It is addictive, and there is no medical use. Cocaine acts as a stimulant, and it's found naturally in the coca plant. The coca plant is not the cacao plant from which chocolate comes from. They're totally different plants. These are going to take effect almost immediately because cocaine is taken through the respiratory system. The effects last for anywhere from 20 minutes to a couple of hours. As a stimulant, it will increase heart rate, respiration, and the fat breakdown in muscles. Cocaine also provides users with a feeling of invincibility, which has led to some unfortunate deaths as a result. It blocks dopamine transmission, resulting in dopamine accumulation in the brain, and this was what leads to its addictive nature. Over time, the decreases in dopamine receptors in the brain can cause cravings and withdrawal symptoms. With long-term use, one consistent feature that's found in these users is that the heart is dramatically damaged. 1 in 7 chronic cocaine users have had heart attacks if they've been addicted for 5 years or more. Crystal methamphetamine, or crystal meth, is another drug that's not commonly used, but you may have heard about. It's in fact pretty rare in the United States these days. It is highly addictive and has been used as secondary treatment for ADHD and obesity. But as a secondary treatment, it's not absolutely necessary in the US. It is a stimulant, and it's not found naturally as it's man-made from pseudoephedrine in cold medication. Crystal methamphetamine is smoked or injected, so it's taken in as through the respiratory system. It takes effect in a few seconds and lasts for hours. There are some long-term physiological effects, as you can see in some of these before and after images of crystal meth users. These physiological effects are a result of the effects on the brain. Crystal meth increases dopamine, norepinephrine or adrenaline, and serotonin levels, causing euphoria and excitement, especially during sexual activities. It also increases focus and may lead to obsession with various tasks, such as picking at certain spots on the face or grinding teeth, leading to these physiological and anatomical changes that you see in the images before you. They also degrade dopamine pathways, leading to addiction, much like cocaine does. And withdrawal from this drug can be severe, involving excessive sleeping and eating, depression, and anxiety. Our last drug that we're going to talk about in this lecture is heroin. Heroin is pretty rarely used these days, but it used to be used a lot more frequently in the past. It is addictive, and there is no medical use. It acts as a depressant, and it's made by combining morphine from the opium poppy with acid. It's often taken as an injection, and it takes seconds then to be absorbed by the body. It results in euphoria, warm skin, and heavy extremities, with alternation between wakeful and drowsy states. Natural endorphins released from the brain are reduced, and over time this makes this drug highly addictive. Withdrawal from heroin can be deadly. It, of course, would include drug craving, but also restlessness, bone and joint pain, muscle pain, insomnia, and vomiting. Methadone is a drug that's used to relieve these symptoms, though methadone itself is also addictive. Long-term use of heroin can lead to eventual damage to the heart and lungs, and these individuals are also more likely to suffer from heart failure within 7 to 10 years. That's it for our drugs in the human body. Good luck on your assignments and your quiz.